Hello everyone, this is Dr. Wayne Smith at Family Chiropractic in Stettler. And today I want to talk to you about chiropractic and x-rays. You know, there are some chiropractic techniques that rely heavily on x-rays. After the image is taken, there's lines and angles and detailed measurements taken to assess what is seen on the image. I choose not to practice that way, and here's why. An x-ray is merely a snapshot, one fraction of a second in time. And sometimes that's not descriptive of what's happening in the entire picture. For example, have you ever watched a scene of a movie and paused it, and in that moment the main character has his face all contorted in some strange way? What if that was the only image you ever saw of that person? What kind of judgments and conclusions would you draw about what they look like, who they are, and what exactly they're doing in that moment? The same can be said about an x-ray. It's one small snapshot in time, and a number of factors can change what you actually see on that image. For example, if my posture is slightly sideways or I'm shifting my weight from one side to the other, that will change the way the image of my bones looks on the x-ray. Similarly, if I'm in pain, which is actually quite likely because that's why you're taking the x-ray in the first place. If I'm in pain, there's going to be some muscle spasm, and that will temporarily change in some way the position of the joints in your back. And this may give you a distorted perspective of what's really going on in the big picture. So back to the movie analogy, it's better to watch the whole scene in real time. You get a lot more information and you can discover what's really going on. Similarly, in a chiropractic perspective, I can take a detailed history and a physical exam and find out a lot about what's going on with your pain. Now, having said all that, do I ever use x-rays? Of course I do. If there's been a trauma, some kind of an accident that's happened to you, then I want to send you for x-rays and make sure that nothing is broken or that there's other problems with the bones. Also, if you're not really responding to treatment, if something just doesn't quite seem right in your clinical picture, I will also send you for an x-ray. And if there's any other red flags that come up during the history or physical where something just doesn't seem right, we'll send you for an x-ray to rule out some other things that might be going on. But for the everyday mechanical back pain that most people experience, x-rays really aren't that necessary. I'm Dr. Wayne Smith from Family Chiropractic, and thank you for watching.